My name is Todd. I live in Orem, Utah. We first learned about Medicaid when my wife got pregnant and has covered her during that time, my wife, and is now covering my little daughter. I'm a full-time student at the University of Utah. One of my part-time jobs is working as a graduate assistant. My other part-time job is my internship, and it's working with the Deseret Industries as a development counselor. Jane brings so much into our life. Being a parent was nothing like we expected. Every day is different, and so she keeps it real. It's fun. When we found out that my wife and Jane would be covered, it definitely felt like a burden lifted, a weight off our shoulders.
The ability to have Medicaid while I was pregnant meant that I didn't have to worry. There was one time that I had to go to the ER. I was able to find comfort in being taken care of through Medicaid.
So after she was born, we were able to know that she still would be covered. Vaccinations, her regular checkups, anything on the healthcare side, she has covered by Medicaid. Not being insured and not having my wife insured is one of the scariest things ever, because what if something happens? I can't get really sick or injured. I have to work, I have to provide, I have to finish school. It's very unnerving not knowing what to do and just kind of being like, I guess we have to suck it up, until we can go to have a doctor someday that we can just go into for a checkup. Like, we don't have that, so it's very scary. We make just enough to not qualify for all the other programs, but we don't make enough to really take care of ourselves the way we would like to, if that makes sense. I used to think people who accessed welfare or healthcare type assistance to the government were just lazy, people who couldn't take care of themselves. And I've never not had a job. I've always worked very hard. I've been in school, but I've never been able to take care of myself the way I'd like to. And so now I have kind of an understanding for why these programs exist and how much they can benefit people who are hardworking Americans who just aren't at the place yet where they can afford private health insurance, or in this situation here in the state that I live in, access it through the Affordable Care Act. I'm Todd. This is my daughter Jane, and she's covered by Medicaid.